Welcome to Atrium Health, Carolina's Medical Center's LVAD program. This video serves to teach patients and caregivers how to perform a sterile dressing change for a driveline exit site. If you have questions regarding the content of this video, please contact your LVAD program coordinators. It's important to properly care for the driveline exit site to prevent infection. The driveline dressing will need to be changed at a minimum of every 3 days, unless instructed by a provider. Tell your care team right away if you notice any changes in or around the driveline site, such as redness, pain or tenderness, new or increased drainage, or swelling and warmth. To start, clean the surface of your work area with a disinfecting wipe. Next, wash your hands thoroughly with soap and water before handling any supplies. Remove and discard the sterile dressing kits, clear outer wrapping, and place the kit on the clean work surface. Open the first flap of the sterile kit and remove the masks and gloves. Place a mask on yourself and one on the patient. Put the sterile glove pack on your work surface and unfold the wrapper using the folded edges until the gloves are exposed. The inside of the glove wrapper is sterile. You can pull on the creases to prevent the wrapper from folding back over on the sterile gloves. Pick up the first sterile glove by the rolled cuff with your dominant hand. Make sure to not touch the outside of the glove with your fingers. The outside surface of the glove is sterile. Slide your other hand into the glove with your palm up. Next, slide the fingers of your sterile gloved hand under the rolled cuff of the other glove. Slide your ungloved hand into the glove, keeping your sterile fingers under the rolled cuff as you pull the glove onto your hand. Make sure your ungloved fingers do not touch the outside of either glove. Open the kit carefully by unfolding the remaining flaps. Be sure to only touch the corners of the blue drape, so the inside of the kit and its contents can remain sterile. Now it is time to remove the old dressing and assess the exit site. Start by releasing the driveline from the anchor and then carefully remove the dressing and anchor without pulling on the driveline. Discard the old dressing and anchor into the trash. Once the dressing is removed and you can see the exit site, look for any signs of infection like redness, swelling, and drainage. Remove and discard the gloves. Perform hand hygiene by either washing your hands with soap and water or using hand sanitizer. Apply the second pair of sterile gloves using the same steps from before. Once the gloves are on, you can now move to organizing the contents of the kit. Each kit comes with a pair of blue forceps, 2 pieces of 4x4 gauze, an anchor to secure the driveline, and the dressing, which consists of 2 pieces. A smaller piece with a gray backing and a larger piece with a clear window and blue backing. The kit also contains a skin protective barrier wand, silver lawn, 2x2 split gauze, 2 ChloraPrep sticks, and a sterile saline wipe. Once the contents of the kit are organized, open the silver lawn package and moisten the silver side with the sterile saline wipe in order to activate. Place the activated silver lawn aside on the tray for later use. Now you can open the skin protective barrier wand. It's best to leave the wand inside the packaging so that the solution doesn't dry out. Place on the tray for later use. Take 1 piece of 4x4 gauze and hold the driveline 6 to 8 inches down from the exit site with your non-dominant hand. With the other hand, activate the first ChloraPrep stick by squeezing the wings until you hear an audible click. This releases the cleaning solution into the round sponge at the end of the stick. Use the ChloroPrep stick to scrub a 5 by 5 inch area around the driveline exit site in a back and forth motion for 15 seconds. Using the same stick, scrub the same area with an up and down motion for another 15 seconds. Discard the ChloroPrep stick. Next, without releasing the driveline, activate the second ChloroPrep stick, again squeezing the wings until you hear an audible click. Starting at the exit site, scrub the top and underside of the driveline for 30 seconds, moving away from the exit site and down the driveline about 6 to 8 inches. Discard the stick. Gently release the driveline and discard the gauze. Allow the skin to dry completely for at least 1 minute. Do not fan or blow on the skin, as that can introduce germs that could cause an infection. Using the second piece of 4 by 4 gauze, gently lift the driveline away from the skin. Apply the skin protective barrier with the wand starting an inch away from the exit site. Circle the skin around the exit site and continue to move outward, not going outside the area that was cleaned. Discard the wand, release the driveline, and discard the gauze. Place the silver lawn on top of the skin around the driveline, with the silver side down and the split facing towards the driveline. Place the 2 by 2 split gauze on top of the silver lawn, with the split in the same direction as the silver lawn. Apply the dressing piece with the blue backing by placing the clear window over the exit site and remove the top portion of the backing first. Gently press the dressing to the skin in order to seal the edges. Then remove the bottom portion of the blue backing. Make sure to center the driveline in the split of the dressing and continue to press gently until all of the edges are sealed. Apply the smaller piece with the gray backing underneath the driveline and over the larger dressing, making sure it is placed far enough to create a complete seal of the driveline. Place the label on top of the dressing, below the clear window. Apply and secure the driveline into the anchor, pulling the wings until they snap into place. Then, date and initial the dressing. Once you've followed all of the steps, discard the gloves and supplies and wash your hands. You have now completed the dressing change. Remember, please contact your LVAD coordinators with any questions or concerns regarding your driveline exit site. Thanks for watching.